Hi, I'm Mary Beth Bennett, future pediatrician, mother of three, and co-founder of the Early Bird program. As a student at Dell Medical School in Austin, Texas, I was fortunate to spend the last academic year working alongside my co-presenters, Dr. Michael Hull and Laura Rosen, who are currently leading the Impact Factory, an engine for civic entrepreneurship and public service opportunities at the University of Texas at Austin. A collaboration between Dell Medical School and the Lyndon B. Johnson School of Public Affairs, the Impact Factory aims to improve health and prosperity for vulnerable populations in the United States. The Impact Factory founder, Dr. Michael Hull, is a community pediatrician who cares for children aboard the Children's Health Express, a mobile unit of Dell Children's Medical Center. By venturing into neighborhoods without easy access to safety net clinics, the Children's Health Express creates more opportunities for low-income families to get timely, well-child or sick care with or without insurance. Our experiences as pediatric healthcare providers serving low-income children inspire much of the work we do at the Impact Factory. But our work isn't only informed by personal experiences, it's also shaped by data about what it means to grow up poor in America. Many people know that health is impacted by poverty, but what fewer people realize is that poverty affects about 39% of children in the U.S. And the deeper blue you go on this graph, the worse off kids are as a result of their family's low income. That 39% means that the health of about 2 in 5 kids who grow up in the U.S. will be negatively impacted by poverty, making it a significant concern for pediatricians. Research has shown the many ways in which poverty negatively impacts child health, including increasing kids' likelihood of suffering developmental delays, developing obesity or severe asthma, and even dying in childhood. Luckily, in a 2016 statement on poverty and child health, the leading pediatrics organization in the country declared that pediatricians should be addressing the issue of child poverty head-on, with more efforts to counteract poverty's negative impacts. Beyond the individual or even population level, child poverty is costly from a systems perspective. As you can see in this chart, the average number of days kids spend in the hospital for infections, asthma, and other conditions increases as their degree of poverty increases. There are many factors that are likely at play here, including transportation barriers which decrease access to preventive care, and poor nutritional status, which can complicate the healing process. But the data is clear. Child poverty isn't good for anyone. Now, health isn't the only domain negatively affected by poverty. Educational and financial outcomes also suffer when families lack sufficient resources to save and plan for the future. We know from our own experiences and from what we hear on the news that college is just not affordable. Costs continue to rise, and students graduating with a 4-year degree do so with an average of $30,000 in student loan debt. That's why so many families, especially those with limited means, hesitate to even bring up college with their kids because they don't want to create a false sense of hope. The fact is, students from low-income families just don't complete higher education at the same rate seen amongst their wealthier peers. One study of high schoolers showed a similar degree of ambition to attend college among various groups of students during freshman year. 3 years later, aspirations to attend college dropped precipitously among the lower socioeconomic status students, even among those who scored well on standardized tests. And the planned enrollment figures assessed after high school drop even lower. Data from our home of Central Texas tells the same story. Only 12 out of every 100 low-income student in Central Texas finish a college degree within 6 years of graduating high school. As a community, we're losing out on the contributions of so many potential skilled professionals. We need to do better. That's where the work of the Impact Factory comes into play. We set out to develop a cross-sector intervention to address several of poverty's negative impacts on families with young children. That intervention is called Early Bird, a first-of-its-kind, clinic-based higher education scholarship program for infants in low-income families. The Early Bird team envisions an America where every growing child has growing savings for higher education. Using milestone-based incentives, Early Bird encourages healthy behaviors today by rewarding them with scholarship dollars that will help children succeed tomorrow. Our theory of change suggests that the best time to intervene in a child's life is early. So early, in fact, that we're reaching out to moms with low income even before their babies are born. We sign moms up for the program and offer them financial coaching right away to help families set and reach financial goals. When participating babies are born, Early Bird establishes a 529 children's savings account in the baby's name with $100 in seed money. As the babies grow, Early Bird rewards families' achievement of healthy milestones, like attending pediatrician and dental checkups and enrolling in pre-K, by depositing funds into their savings accounts. Early Bird's milestone incentives are tied to health payer priorities. That's part of Early Bird's sustainability plan. We aim to show increases in achievement of the following milestones as compared with a control cohort in order to demonstrate to insurers that the Early Bird model is an effective tool for improving health outcomes. Foundational milestones tied to scholarship deposits include 1. Mom's attendance at her 6-week postpartum visit, which we know is important for getting started on long-acting, low-maintenance birth control, as well as getting screened for postpartum depression. 2. Getting established at a dental home with a visit for the baby before age 1. 3. Attending all 6 recommended well-child checks by age 15 months. Visits that are important for helping parents feel reassured that their child is growing and developing normally, and they're also when important vaccinations of early childhood are administered. 4. Either mom or dad can earn funds by attending individual financial coaching sessions. And 5. Enrolling in pre-kindergarten for 3-year-olds or a comparable high-quality education program. This represents $470 in scholarships for children whose families achieve all program milestones. Early Bird, a cross-sector and multifaceted intervention, is not possible without partnerships. For example, the United Way for Greater Austin, a long-standing and trusted community organization with expertise in early childhood, will serve as our scholarship administrator. A local nonprofit called Foundation Communities offers free financial coaching to our clients, leaning on their years of experience offering financial education to support Austin families. And of course, we could not offer a clinic-based scholarship service without our clinical and CSA partners, Lone Star Circle of Care in Austin and My 529, respectively. Our pilot location will be a site that combines both women's health and pediatrics services, meaning that moms who we recruit there while pregnant will bring their babies back to the same clinic after delivery. The personal connection to families that's foundational to the Early Bird model posed some real challenges during the early days of the COVID-19 pandemic, when face-to-face research was halted for university personnel and clinics transitioned a large portion of the preventive care appointments to a virtual model in order to keep pregnant patients safe. We considered changing our study approach to rely on virtual recruiting, but we knew that in-person connections have been fundamental to the success of similar programs. So with input from our clinical partner, we were able to develop a strategy for safe in-person recruitment into the program. It's our hope that Early Bird's financial coaching component, which will likely be offered on a virtual basis, will be an even more valuable resource for families in light of the COVID-19 pandemic. Statistics have shown that low-income families and families of color have been disproportionately affected by this crisis, both in terms of their health and their economic situation. Multifaceted interventions like Early Bird can help provide support to families who may need it most during these unprecedented times. As of today, all program partners are in place, and we've secured more than $55,000 in funds to launch our pilot program, planned for fall 2020. We aim to enroll roughly 200 children and their families in the program, most of whom will be families of color. And finally, our longitudinal study findings will help influence a scalable model for replication of the Early Bird program in other cities across the United States. If you're interested in learning more about Early Bird and following our progress, sign up to receive email updates at earlybirdfund.org. Thank you.